We're at the 3D Approach Lab at Cook Children's Medical Center. We virtually plan and three-dimensionally print children's hearts for surgical and interventional care. It moves you from a mental model of really a bunch of two-dimensional images that you take and reconstruct to actually seeing the child's heart in all three dimensions. So you have a full understanding of their anatomy and how their anatomy affects their physiology. We're taking MRI or CT data and we're creating replicas, models essentially, which is, like I said, what we do currently in our brain. We create a model of the heart, but is often somewhat flawed. And here we're actually able to create that model so we can understand and educate families, educate caregivers, and facilitate their care. It's almost better than I thought it was going to be honest with you. And I think that it's not so much that the technology is different than I thought it was going to be, but it's the feedback that I'm getting from the families and especially from the surgeons about how it's affecting them. In cases where a lot of the problem is outside or extra cardiac, then printing doesn't work very well. If you're trying to print, 15 small vessels that are winding through the chest in addition to the heart, that isn't very feasible. So we're able to use virtual world to understand in 3 dimensions what we can't print. I think the possibilities are really pretty endless.